Doctors at your usual checkups often overlook this crucial fact. But let me be straightforward. If you have ceased masturbating in your later years, your body might already be deteriorating, and you may not even realize it. This is not some taboo subject or locker room myth. This is a genuine clinical and physiological reality. Ignoring this truth can have severe consequences, not only for your sexual health, but also for your brain, your heart, your sleep, your immune defenses, and even your personal identity. My name is Dr. Michael Z. I am a urologist and specialist in men's health, with more than 30 years of experience caring for aging patients nationwide. Throughout my career, I have focused on understanding how the body transforms with age, particularly in relation to intimacy hormones and lasting vitality. One of the most overlooked risks I have encountered is that many older adults give up on their sexual health and lose access to a critical component of their overall well-being. What might surprise you is that masturbation is not merely a leftover urge from youth. It is actually one of the strongest mechanisms your aging body uses to regulate hormones, enhance cognitive function, safeguard your prostate, and even combat depression. If you have stopped or never engaged in it, the toll on your health could be much greater than you imagine. Over the next few minutes, I will explain in detail what takes place inside your body and why maintaining this aspect of health is vital as you grow older. What happens to your body when you stop masturbating in later years might change your perspective on health and self-care completely from this moment onward. Before we dive in, if you want to maintain your mental sharpness, physical health, and independence as you grow older, please subscribe and activate the notification bell so you never miss essential tips created specifically for you. If this message strikes a chord, type 1 in the comments section. Otherwise, type 0. Your input helps me deliver content that genuinely supports your well-being and vitality. Now, let's explore the first and often unnoticed effect of ceasing masturbation in older age and how it silently impacts your prostate and urinary functions. When I began my career in urology more than 30 years ago, I did not expect many of my patients to openly discuss such a private yet vital topic. The quiet cessation of sexual activity during later years drew my attention. One particular gentleman, who I recall vividly, told me, "Doctor, I just assumed that part of life was no longer necessary." He was in his early 70s, fit and alert, but regularly woke up 4 or 5 times at night to urinate and could not figure out why. What he overlooked, as do many men, is that consistent ejaculation, including masturbation, plays an essential role in maintaining proper prostate function. The prostate is much more than a passive gland resting inside the body. It is a living, active organ that produces fluid, expanding and contracting regularly. Like any system, it can suffer when ignored. Without proper stimulation and release, the fluid in the prostate may become stagnant. This stagnation forms an ideal environment for inflammation, swelling, and eventually pressure that interferes with many functions, such as urination and sexual performance. You might experience symptoms like a heavier bladder, a weaker urine stream, or a persistent sensation of fullness that never seems to disappear. These signs are not mere annoyances, they serve as early alerts. Here comes the serious part. Long-term prostate congestion can secretly develop into more severe problems, including benign prostatic hyperplasia, or BPH, which affects nearly half of men over 60 years old. If left untreated, this condition might cause urinary retention, bladder infections, and even necessitate the use of a catheter. The man mentioned earlier eventually required surgery to relieve this pressure. This could have been avoided if simple, consistent habits were adopted earlier. Regular ejaculation helps by flushing the prostate, clearing out old fluid, and decreasing the likelihood of buildup. Research has demonstrated that men who ejaculate 21 times or more each month are substantially less prone to developing prostate cancer compared to those who do not. To be perfectly clear, this is not about regaining youth or indulging in obsessive behavior. It is not about fantasies, but about maintaining proper function and health. Using your own biology to safeguard your body in the simplest and most natural manner is possible. When you stop engaging in self-stimulation in later years, you are not merely denying yourself pleasure, but exposing yourself to discomfort, inflammation, and a slow loss of control over one of the most fundamental bodily functions, urination. I have treated people who have become so anxious about their bladders that they avoid leaving their homes altogether. I have witnessed strong, dignified men endure restless nights and daytime stress caused by a condition that might have been managed or prevented through something as straightforward as consistent self-stimulation. There is also a psychological burden to consider. Losing command over your body in this way, having to plan bathroom visits and fearing long trips in a car, waking every 2 hours during the night, it all chips away at your feeling of independence. This issue is not only about the prostate, it concerns your personal freedom. What makes this even more striking is that what begins in the prostate does not remain confined there. The following consequence impacts not just the physical body, but the mind as well. Once this process starts, it can change how you think, feel, and remember in ways that may be challenging to reverse. Let us explore what happens to your mental sharpness and cognitive abilities when regular self-stimulation is taken out of your daily habits. If you are still watching and these ideas resonate with you, type the word 1 in the comments. This shows that you are still engaged and appreciate this message. Now, let us proceed to the second point. A short time ago, a man in his late 60s came to see me. He was not concerned about his prostate or his vitality, but he said something that caught my attention. He said, "Doctor, I do not feel like myself anymore. I walk into a room and forget why I came. I lose my train of thought in the middle of a sentence. I used to be so sharp. Is this just part of growing old?" This is a question I hear far more often than you might expect. Of course, aging naturally involves some changes in cognitive function, but what many people, even well-educated health-conscious individuals, do not realize is that sexual activity, including masturbation, has a significant role in preserving brain health. When you participate in self-pleasure, your brain releases a mixture of neurochemicals such as dopamine, serotonin, and oxytocin. These chemicals are closely associated with memory, concentration, and emotional control. They do more than simply make you feel good at the moment. They help strengthen and safeguard neural pathways. They encourage blood circulation in the brain and lower levels of cortisol, the stress hormone which, when elevated, can harm brain cells. When you cease masturbating, especially for an extended time, these natural boosts of brain-protecting chemicals occur less often. Over time, this can blunt your mental sharpness. You might find it tougher to focus, to absorb information, or even to feel driven. This decline does not happen suddenly. It creeps in gradually. At first, you forget names, and then everyday things start slipping away. When you lose track of the day, doubts can overwhelm your mind completely, and from that uncertainty, something even worse may take hold: fear. I have witnessed individuals spiral into anxiety and depression simply because they convinced themselves they were failing, while in reality their brains lack proper stimulation and chemical balance. For men, there is an additional hormonal factor. Testosterone, a hormone closely related to memory, decisiveness, and energy, can decline more rapidly when sexual activity falls almost to zero. Testosterone is not only about desire, it affects your identity, strength, and mental clarity. Frequent and healthy ejaculation can play a role in maintaining testosterone levels as you grow older. Some research is beginning to connect diminished sexual activity among senior adults to early signs of cognitive decline, sometimes even dementia. I am not claiming that halting masturbation causes Alzheimer's disease, but what I am stating is that when the brain lacks stimulation, emotional release, and hormonal support, it becomes more fragile. It loses its natural flow and resilience. For many people, this mental haze thickens enough to alter their lifestyle, interactions, thinking, and self-perception. One man mentioned he quit attending his chess club because he could no longer concentrate on the game. Another, a retired educator, said he awoke feeling blank each day. These were not memory disorders requiring medication, but symptoms of a life separated from physical intimacy. Taking care of yourself, and here lies the heartbreaking truth. These issues are preventable. You do not require costly medications or specialized treatments. Sometimes the process begins by simply reconnecting with your own body and providing it with the attention it subtly yearns for. When you activate your body, you also awaken your mind. However, the decline in mental clarity represents only one aspect of the problem. What follows when your emotional stability starts to deteriorate and your mood unexpectedly falters can be even more hidden, more harmful, and far more difficult to discuss. Let us examine how neglecting self-intimacy can quietly allow depression to creep into everyday life. I recall a patient in his early 70s, a widower retired with relatively good health, who came to me not due to a physical complaint, but because of a feeling he could not clearly describe. He looked straight into my eyes and said, "I do not feel anything anymore, not sadness nor joy, just emptiness." After a pause, he asked, "Is this normal for someone my age?" That question lingers in my thoughts since I encounter similar concerns frequently. Many assume dullness, detachment, and the slow disappearance of emotions are simply natural parts of aging. Yet these symptoms often stem from a deeper, physiological source that remains rarely addressed. The decline in sexual stimulation, especially through self-pleasure. The reality is when you cease engaging with your own body on an intimate, physical level, your emotional world can subtly but significantly transform. Masturbation is not merely a physical act. It plays an essential role in maintaining emotional health. It is not just a physical action, but also an emotional outlet, functioning as your body's natural stress relief mechanism. During climax, the brain secretes potent substances such as oxytocin and endorphins, which are natural mood boosters that help reduce anxiety, tension, and feelings of sadness. When this release is taken away from your life, especially during periods of stress, loneliness, or grief, there is a risk of becoming emotionally detached. This numbness can gradually develop into something more harmful, depression. I have observed this process unfold slowly. A person might stop engaging in self-pleasure after losing a partner, or because they believe it is no longer suitable for their age. Days turn into weeks, then months. They become quieter, more isolated, and lose interest in hobbies and even social interactions. Their sleep patterns may change, appetite fluctuates, and life seems to lose its color. What is tragic is that many do not recognize the connection, blaming themselves or thinking it is simply how life has become. In truth, what they are missing is a fundamental act of reconnecting with their own body, not just for pleasure, but for emotional well-being. Depression among older adults often goes unnoticed because it does not always manifest as sadness. It can appear as tiredness, irritability, detachment, or a lack of motivation and desire. While medications and therapy remain important, I cannot count how many patients I have helped just by encouraging them to reclaim physical intimacy with themselves. A man once shared with me that he felt truly alive again after he started touching himself regularly for the first time in many years. He said it was not only an uplift to his mood, but also a powerful reminder that he remained human, not merely a body destined to shut down. This simple action restored a part of himself he believed was lost forever. This insight is vital to grasp. Masturbation in later years is not about fantasy, desire, or embarrassment. It is about sustaining your emotional well-being and giving your body a chance to feel, to let go, and to reconnect with the moment. When that link fades, the risk is not just feeling sad, but enduring loneliness, emotional decline, and sometimes losing the motivation to participate in life at all. Furthermore, the emotional impacts are not the only consequences. As nights lengthen and your sleep turns fragmented, another silent problem begins to increase, one that can harm your memory, weaken your immune system, and raise the likelihood of serious illness. Next, let us explore how the lack of sexual release might be robbing your body of the deep restorative sleep it desperately requires. If you are still watching and find these ideas meaningful, type the number 1 in the comments to show you are here and engaged. Now, moving on to the fourth point, poor sleep quality. I remember a man in his late 60s who came to me after struggling with bad sleep for months. He appeared exhausted, pale, and deeply annoyed. The doctor said I fall asleep easily, but then I suddenly wake up at 2 o'clock in the morning as if I were launched from a cannon. After that, I'd just lie awake, staring at the ceiling, waiting for daylight. We conducted several tests and his laboratory results came back clean, with no signs of apnea or any serious issues. However, when I carefully inquired about his intimate life, he averted his gaze and said that part of his life was over. Yet the very aspect he believed had passed might actually hold the key to what his body desperately needs: restorative and uninterrupted rest. Sleep is not merely about closing your eyes and remaining still. It involves a complex hormonal process. One of the most powerful natural triggers for deep sleep, often overlooked by many, is orgasm. After a certain age, during climax, the body releases a blend of oxytocin, prolactin, and endorphins, a perfect chemical mix created by nature to switch the nervous system from a state of stress to one of calm. Simultaneously, cortisol, the hormone linked to anxiety and alertness, drops significantly. Breathing slows, heart rate stabilizes, muscles unwind, and the body enters an optimal state for deep sleep. Now imagine removing this process entirely from your life, not just once, but continuously for weeks, months, or even years. This is what occurs when older adults stop engaging in masturbation. The body loses a vital natural mechanism it once depended on. The void that follows is often filled with restlessness, irritability, and restless nights. Some resort to sleeping pills, whereas others resign themselves to fatigue as their new reality. But the repercussions of inadequate sleep are undeniable. Sleep affects much more than simply feeling weary. Persistent lack of rest damages the immune system, speeds up mental decline, increases the chance of cardiovascular problems, and heightens susceptibility to anxiety and depression. For older individuals, it also leads to falls, memory difficulties, and a loss of autonomy. I have observed patients who once lived vibrant, involved lives gradually retreating, not due to any severe illness, but purely because they were too drained to carry on. What is even more concerning is that many of them were unaware they were missing the very thing that used to help them rest. It is not a medicine or supplement, but their own body's natural release mechanism. Masturbation might appear insignificant, even trivial, yet for some, it can be the key between receiving 4 hours of interrupted sleep and 7 hours of deep, restorative rest. One patient shared after reconnecting with this aspect of himself, "I sleep like I did 3 decades ago. I didn't realize how much I needed that release. I thought I was just aging." This is the issue: too many mistake biological neglect for the aging process and silently endure the consequences. If you find yourself lying awake with a restless mind, tense muscles, and hours passing slowly, consider when your body last felt completely relaxed and at ease. Often the solution is not a new drug or relaxation technique. Sometimes it involves rediscovering an old rhythm your body still knows how to follow if you allow it. While losing sleep can gradually drain your energy and cloud your mind, the next effect we will discuss is even more physical. It reveals itself through weakening muscles, altered balance, and unexpected bladder issues. Let's examine what truly occurs to your pelvic floor and circulation when intimate moments fade away. Several years ago, I worked with a retired firefighter in his 70s, a man who had been proud and physically strong throughout his life. He came to me reporting mild urinary leaks and trouble standing for extended periods due to pain in his lower back and hips. "It feels strange," he said, "like the base of my body is slowly collapsing." What he described was not merely aging, but a gradual, quiet weakening of his pelvic floor muscles. You see, the pelvic floor consists of muscles located at the core's foundation, responsible for supporting the bladder, bowel, and sexual organs. Most people only notice these muscles when problems arise, such as urine leakage, constipation, erectile difficulties, or discomfort while standing or walking. However, what is often overlooked is the critical role regular sexual activity, including masturbation, has in maintaining these muscles' strength and activation. During arousal and climax, the pelvic floor contracts rhythmically, providing essential exercise for function rather than appearance. It enhances circulation to the lower limbs, strengthens the internal support network, and maintains effective communication between nerves and muscles. The focus is not on performance, but on preservation. When someone stops masturbating regularly, those muscles do not simply become inactive, they start to weaken. Blood circulation diminishes, tissues lose elasticity, nerve reactions weaken, and eventually, one might experience unexpected problems such as frequent urges to urinate, slight leaking after using the restroom, difficulty controlling gas, or even pain when moving. For men, this can result in a significant decline in sexual function, while for women, it may cause dryness, tension, and discomfort that negatively affect intimacy. I have witnessed once independent adults shy away from social activities because they no longer trust their bladder. Others feel ashamed due to sudden leaks triggered by coughing or sneezing, unaware that these issues all stem from long-term neglect of circulation and muscle activity in the pelvic region. It is important to understand that neglecting this area is not merely inconvenient, but can lead to falls, incontinence, and a loss of dignity no one deserves. People might find themselves depending on pads, specialized underwear, or carefully planning bathroom visits simply because the foundation of their body is not receiving the stimulation and support necessary. The longer this condition persists, the more difficult it becomes to reverse. What truly saddens me is how many people face these consequences unknowingly. Many individuals endure silently without sharing their struggles, feeling embarrassed, puzzled, or believing it is simply a natural part of aging. However, I want to emphasize that the body still desires to perform well even at 70, 80, or beyond. One of the most powerful natural methods to support this without relying on medication or devices is through consistent, safe, intimate stimulation. When you reclaim this connection, you are not just triggering pleasure, but also rebuilding strength, directing blood flow to essential areas, revitalizing nerves, maintaining healthy tissues, and reminding your lower body of its importance. While this effect on the body is significant, there is a deeper impact on the immune system, cellular defenses, and the body's capacity to shield itself from illnesses. The changes in your bloodstream following orgasm may represent one of the most crucial and often neglected health benefits. Now, let us explore how sexual inactivity might be silently undermining your immunity through reduced immune function. Several winters ago, one of my long-term patients, a man in his late 60s who had generally been in good health, came to me looking worn out. He had fallen ill 3 times that season, struggling with persistent colds and mild infections. He explained that whereas before he would recover within a couple of days, every minor illness now debilitated him for weeks. After excluding common causes such as diet, sleep, and medications, I carefully inquired about another aspect of his lifestyle. He admitted he had not been sexually active at all, even alone, smiling awkwardly before shaking his head and saying, "No, not for a long time. That part of me is simply retired." What he did not understand, and what many others overlook, is that sexual activity, including masturbation, directly affects the immune system. This is not a figure of speech, it is science. During sexual excitement, and especially orgasm, the body releases a flood of biochemicals. These are not only dopamine and oxytocin, which create feelings of pleasure, but also substances that boost immunity. For instance, immunoglobulin A, known as IgA, rises significantly. This antibody plays a crucial role in protecting the body from viruses, bacteria, and infections, particularly within the respiratory and digestive systems. Additionally, endorphins are released, which help reduce inflammation and promote healing. Now picture going without this natural reinforcement not just for a week, but for several months or even years. The body gradually loses one of its most effective and natural defense mechanisms. At a stage in life when the immune system naturally declines, removing this support is like taking the batteries out of a smoke detector. The effects may not be obvious immediately, but when illness strikes, the body's response is weaker than before. I have witnessed this in real life. Patients who have stopped their intimate lives often fall ill more often, recover more slowly, or suffer from flare-ups of chronic inflammation. While they may not make the connection, their bodies are clearly sending a warning signal about what is happening inside. The immune system is not only about resisting the flu, it plays a crucial role in preventing long-lasting illnesses. It helps monitor for cancer, protect the heart, and even supports wound recovery. Regular sexual activity contributes to maintaining hormonal balance, lowers stress hormones like cortisol, and improves blood flow. All these factors are vital for a strong immune response. When sexual activity ceases, a chain reaction begins. Stress levels rise, sleep quality declines, inflammation worsens, and the body gradually weakens and slows down. A woman in her 70s who had lost her spouse shared with me that she had not engaged in any sexual activity for almost 5 years. When we discussed openly how sex and immune health are connected, she decided to reconnect with that part of herself, not for pleasure but for health reasons. A few months later, she came back with brighter eyes and renewed energy. She said, "I cannot explain it, but I feel more alive, as if my body is cooperating with me, not working against me." This is not magic. It is what happens when the body receives the right signals. Signals that say, "We are still here. We want to thrive." Although it may be easy to ignore, feel uncomfortable about, or dismiss, the immune system does not react to shame but only to action. Sexual stimulation, even when alone, provides a powerful message of life and vitality to every cell in the body. Yet, reduced immunity can make one vulnerable. Neglecting self-intimacy can deeply affect your sense of self, leaving wounds that reach far beyond the surface of your body. When you cease to connect through touch with your own flesh, you may gradually lose the feeling of truly belonging to yourself. Let us delve into how ignoring this intimate connection can subtly diminish your self-esteem and discover ways to restore it. I will always remember a soft-spoken exchange with a patient in his late 70s. He was a former school principal, once sharp, confident, and commanding as a leader. However, during a routine examination, something in his demeanor seemed altered. His shoulders slightly slumped, his gaze not as bright. As our conversation unfolded, he sighed and admitted, "I no longer feel like I live inside this body. It feels like I am merely residing within it." Those words lingered with me because they reveal a common experience. Many men and women express this feeling differently, yet all describe a shared truth. At some point, they stop feeling comfortable in their own skin. This often begins quietly, with a gradual abandonment of self-touch, dismissed as unnecessary, outdated, or something left behind with youth. But the real consequence of forsaking that personal connection to your body is profound. When you withdraw from this tactile awareness, you start to drift apart from yourself. This separation occurs slowly and silently, sometimes forever. Touching oneself is not only about seeking enjoyment, it is about being present in your own being. Even the gentlest contact reawakens your sense of life and belonging within your own form. With no purpose other than to reconnect, you remind your nervous system that you are still present, that you matter, that your body remains part of who you are, and not just a shell you plan to leave behind. Without this reminder, something shifts. A certain emotional and mental distance emerges. It becomes simpler to dismiss minor discomforts, easier to avoid the mirror, easier to convince yourself that this stage of life does not deserve care. This is the most perilous loss of all, the loss of your own sense of value. I have witnessed this disconnection lead to profound emotional numbness, feelings of shame about getting older, detachment from physical touch, and even a decline in motivation for basic self-care. People stop moving regularly, neglect healthy eating, and dress without purpose. They question why they should bother when the body no longer feels like their own. One woman confided that she had not touched herself since going through menopause, saying, "I just stopped feeling like a woman," and then added, "The less I touch myself, the more I vanished." That word vanish strikes deeply because that is exactly what happens to many older adults who cease to engage with their bodies. They do not just lose sensual pleasure, but also identity, presence, and the feeling of being alive. Here is the crucial part I want you to understand. It does not have to be this way. Reclaiming your body through self-touch is not about trying to be sexual as you were in your 20s. It is about honoring the life that still lives within you. It is a way of affirming, "I am still here, I still feel, I still exist." You deserve to be acknowledged even by yourself. When you reconnect with your body, even in the comfort of your own space, you start to undo that silent erasure of your being. You remind yourself that growing older does not mean disappearing, and that your value did not vanish alongside your youth. You return to your true self, and perhaps that is the most restorative act of all. As we reach the conclusion of this journey, let's bring everything together because, although each of these 7 effects is significant on its own, together they reveal a much deeper and more urgent reality. In this final message, I want to make clear what is truly at risk, and, more importantly, how you can regain control starting right now. Reflecting on reclaiming intimacy and wellness, over the years spent supporting aging individuals, what stands out most is not just the physical obstacles they confront, but the silent, invisible losses they endure. These are losses unseen in tests or scans. A man who once held himself with pride now avoids mirrors. A woman who used to glow with happiness and comfort feels numb in her own body for countless years. Too often, they are told this simply represents the natural process of aging, but I refuse to accept that for a moment. If you have followed me this far, I doubt you believe it either. Here is the reality. The instant you stop nurturing your sexual self, The moment you neglect that part of your body and identity, a chain of quiet consequences begins to form. We have examined them one by one. One way that prostate and urinary health can deteriorate is when regular release is no longer part of the routine. The brain becomes less clear and sharp when deprived of stimulation. The lack of physical intimacy may lead to feelings of depression, disturb sleep patterns, impair circulation, and even weaken the immune system. Perhaps the most painful aspect is how losing that private, personal connection with your own body can gradually erode your self-worth until you begin to feel like a stranger to yourself. These are significant issues, not merely natural signs of aging. They are clear signals from your body, mind, and spirit demanding your attention. I have sat with patients who felt broken, detached, and numb, and I witnessed the change in their eyes when they started to reclaim this part of their lives. It does not require another person. It does not demand youth or perfect health. What it asks for is your permission to view yourself as deserving of intimacy, even now, especially now. I understand this topic is difficult for many to discuss. Some feel embarrassed, while others were never taught that caring for their sexual health after a certain age is acceptable. But I want you to hear this from a doctor who has supported thousands of men and women through this journey. It is not only acceptable, it is crucial. Masturbation later in life is not about indulgence. It is about promoting circulation, enhancing mental clarity, maintaining hormonal balance, providing emotional grounding, supporting immune function, and reinforcing personal identity. It is not a luxury, it is an essential form of self-care. Taking care of yourself is a way to affirm that you are still present in this body and responsible for its well-being. One patient once shared with me, "I never realized how much I miss feeling like myself until I touched that part of me again." This experience is about more than mere survival. It is about truly feeling alive. It means not only getting through the years, but living them fully with awareness, dignity, and happiness. If you have lost touch with this part of yourself or dismissed it or judged it harshly, I encourage you to pause and reconnect. Remember that your body remains attentive, capable, and worthy. Begin gently with curiosity and compassion, but above all, begin at all. By choosing to nurture this part of yourself once more, you protect your health and reclaim your existence. If these words touched you, please do not keep them to yourself. Share this video with someone who needs to hear it and leave a comment below to tell me your thoughts. Whether you agree, disagree, or have questions, know that your voice is important and your story might inspire someone else to feel understood.